I'd like to open tonight's panel by just saying that as union members, a lot of times in our own particular union, like if they don't expressly endorse or support a piece of legislation or a movement, that sometimes can leave us feeling a little bit ambiguous about like what we can do, either as individuals or as a union member, or even feel like we might not have a safe place to speak about things that we're passionate about. And so that's why I just wanted to say I feel so happy to have this space of LA Young Workers, to be able to invite you all tonight, to have everyone here to gather. And we really strive to be that safe space where discussion is open-ended and presented without any limitations or constraints. And that spirit is well and alive tonight. So Jenny, I'd like to hand it over to you.
Thanks so much, Linda. Thank you. And thank you also to the Executive Council. I am afraid to name all the names. There's not even that many, but I just don't want to miss anyone. But you all are awesome. You really push the envelope, and thank you for inviting me to be part of the group. Like, safe space, I think, is so important. I've learned a lot from you all because, if you're not part of a union, which I am not because I work for Kalra, a retirees organization, it's hard to know how to, it's a tough nut to crack. It's like, what is going on? There's these contradictions and you ask all these questions, and then you learn more by people being honest in these safe spaces. And so those of you who are young workers in the LA area, if you're joining for the first time or haven't been engaged in a while, you just heard Linda, the elections have been pushed back. So, join the group, run for one of the seats, get involved. They're doing great things right now, and we need more help. But on to our program. I'm so excited about it. I'm gonna let the voices from the community speak. And so next up we have Selena Barón. She's coming from IBEW. Actually, I'm gonna let her tell you more about that because her story is very much about union and healthcare.
Hi, everybody. So my name is Selena Barón. I'm a journey level electrician with the International Brotherhood of Electrical Workers, or IBEW. I'm a member of Local 11, the other Local 11, Los Angeles, which is primarily a construction local. So I've worked on new construction and renovation of things like stadiums and hospitals and universities. It's incredibly rewarding to go to work every day and make a building a little more there. It's also dirty, physically exhausting, and hazardous. As union electricians, we pride ourselves on being skilled workers, but construction is inherently dangerous. When I was pregnant with my daughter, Ruby, it took a while to get my doctor to understand that as an electrician, I don't sit at a desk and draw building plans, but that I regularly work at heights, lift heavy loads, and that I'm exposed to unsafe chemicals and debris, like dust and all sorts of other nonsense in the air that you definitely don't want to be breathing in. Many women feel safe working in construction while pregnant, but others don't. And sometimes pregnancies develop complications. Other times, regular and mild pregnancy symptoms like dizziness and fatigue and the looser ligaments that will eventually help with delivery can be serious risks on a job site. And a big factor of my choosing to work through my pregnancy was health insurance. So there's a lot of ways that health insurance is paid for, but at IBEW Local 11, our employer contributes on our behalf to our health insurance by the worked hour, as opposed to a set total fee. So once we've worked an established amount of hours to compensate for a month's worth of insurance coverage, additional hours can be banked for up to 6 months of future use. So that means that I would have to work the majority of my pregnancy in order to ensure that I would keep my health insurance to cover us through labor and delivery. And I was really lucky that my daughter was born healthy and that our health insurance plan covered almost all the expenses. It's often referred to as a Cadillac plan. One of the biggest fears that union members like me have is losing it. But what we're really afraid of are the wild costs and the lack of access to healthcare. We're often urged by our union representation to forego raises and money on the check in favor of contributing more significantly to our health insurance plans, whose rates continue to escalate. While we do have dental and vision plans, things like replacement prescription safety glasses, braces, and mental health care increasingly come out of pocket. In an effort to plan for those expenses, our union has further divvied our raises to contribute to an HRA or a health savings account. But we certainly didn't plan for COVID. And the issue that affects most working moms, a lack of childcare, cost me my health insurance. It's already wildly difficult to find childcare for a job that often starts at 5 a.m., has erratic needs for overtime, and is in locations that vary across the county. Adding COVID-19 to the mix with its school closures and heightened risks for people of color meant that I stopped working to care for my children full time. After 6 months of my bank hours elapsed and I lost my health insurance in the middle of the pandemic. And I joined a union in part to have great health insurance. It's incredibly attractive to single mothers like me, to families, and to those of us with bodies, even young bodies. We're often encouraged to give up wages or to work when we feel like it compromises our health in order to keep our access to medical care. I love my union sisters and brothers, and I'm proud to build Los Angeles with them, and we deserve great medical care. But I don't believe that people without a union or people without Cadillac plans or people who have had to leave their jobs to safely carry a pregnancy to term or people who couldn't work through a pandemic are any less deserving of healthcare, because it is a human right. If the pandemic taught us anything, it definitely demonstrated that health is a public good and that our health is dependent on the health of those in our families and in our communities, which is why we should add them to our health plan. One big health plan to take care of all of us. Young workers like me have small children and aging parents and chosen family to care for. And we will continue to push our unions and our government towards Medicare for all. I'd like to urge the governor, Gavin Newsom, and all the state legislators and everyone who works in government and every union member and everyone really to work towards being as progressive as California's reputation. We should be leading the way, and we can. Thanks so much.
I see the love in the room. Thank you. Union to union, it's so important. And I will say, as a mother hearing your story, I'm very moved. The thought of being forced to work so you can bank healthcare hours it's cruel. Thank you so much for being here and sharing your story. I know you worked on that and are really speaking from the heart. So we've heard a bit from our community members. I want to introduce next to tell us what single payer is, because there's a lot of confusion still. I think what people understand is that it's healthcare for everybody, but not necessarily how it works or what it's about. So I want to introduce Pilar Chiava, who's a longtime organizer. She's worked at the California Nurses Association, is now working for Healthy California Now. And she really knows the ins and outs and how to explain it to an audience. So, and she happens to be running for Assembly in District 38. But Pilar, floor is yours.
Hi, thank you. Hi, everybody. And thank you so much for sharing your stories. I mean, this is what drives the work that we do to fight for single payer. I've been organizing around this issue for 10 years. I know folks are on this call who've been organizing around this issue for 20 and 30 years, and it's really painful to think about all the lives that could have been saved, could have been positively impacted if we had done this 10 or 20 or 30 years ago when we should have. And so let me just do a little quick explanation of what single payer is, because I think the language gets confusing sometimes. I'm just going to share my screen because I'm a visual person, and sometimes I think that helps. And hopefully this is, can people see this okay?
Looks great.
Okay. So so this is from a former life and a former campaign, but still relevant. And basically, single payer is kind of this wonky word that doesn't make any sense to anyone, but essentially what it means is just how we pay for healthcare. If we were to enact a single payer system like Medicare for all, like the VA, we already have 2 single payer systems here in the United States already working, you know, and saving lives and keeping people from going bankrupt all the time, my family included. My dad got cancer twice and was saved by the VA, and our family did not go bankrupt purely because he had VA healthcare. So this is just how it would work. If you're not paying an insurance company anymore and they're not taking $16, you know, 16% off the top of every, you know, dollar that you spend, and then trying to block you from getting care while they're at it because that costs them money, then how does healthcare get paid for, right? And so essentially, you know, on the top here, you can see all of the public dollars, right? The public dollars from Medicare and Medi-Cal, federal dollars and state dollars that go into funding healthcare, and then employer and individual contributions. So if we, you know, we're able to enact a single payer system, then employers theoretically would probably pay something into that, like a lot of employers already do, but it would probably be a lot less than they already do. And individuals also would pay a little bit depending on their ability, right? And so all of that would go into a single payer trust fund, essentially, that would then pay for your healthcare. So your prescriptions, your providers, any coordinated services like Kaiser, if that's an option, or, you know, if it's just direct to a provider, that's another way, you know, that it can be done. This is a slide from SB 562, which I just grabbed really quick. So it's an old bill. But so that's essentially kind of how it works, is that the dollars just go into one single fund. That's why they call it a single payer instead of all these multi-payers that are, you know, different sources. You can get CHIP money or Medicare money or federal dollars or state dollars. And there's all these different confusing ways that healthcare is paid for. We just simplify it into one fund. That one fund pays for all of the medically necessary care, including, you know, vision and dental and hearing and a lot of things that are not covered by people's health care. And it would, you know, provide, oh, I'm going backwards. It would provide that kind of care for everyone, regardless of your ability to pay. And if you'll indulge me, I had to, because I see it here and I just have to show my favorite slide, if that's okay. Because I think it makes the best case, oh, sorry, that's not what I'm trying to do. I think it makes the best case for how we know it really works. And so this is, you know, it's a couple years old now, but probably the numbers have gone up a little bit, but where they're at is probably pretty much the same. So if you look at this slide on the left, it's all these different countries, and then it's how much they pay for per person for healthcare, right? So Switzerland is at the top at 6,700, and then we go down. New Zealand, oh, I keep doing that, sorry. New Zealand's in the middle, 3,500, right? And then the lines go over to the right side, which is average life expectancy at birth. So this is kind of how long people live on average, right? So the median is in the middle. It's around $3,600 a person a year for healthcare, and 79 is about how long they live. And then the thickness of the line is how many times they go to the doctor. So you would think, well, you know, they must not be going to the doctor very much because, you know, they're paying so little for healthcare. That's not true. I mean, look at Japan. Japan, they go 12 plus times, right, a year. You know, so it's not really related to that. And if you look at where the United States is, we are off the chart. We are way up here at the top. It's so embarrassing. We're paying, you know, 3 times the median, the average that people are paying for healthcare, right? And you look at the thickness of our line, it's not because we're going to the doctor all the time, and we have a worse life expectancy, right? So, you know, it's just an example of really how broken our healthcare system and how, you know, paying for is paying more is not getting us better healthcare. It's not getting us better outcomes. It's not saving lives, and it's certainly making a lot of people go bankrupt. So that's a quick and dirty primer on what Medicare for All is, how we know it would work, and appreciate everyone coming together and the work you all are doing around building this movement. So thank you.
Excellent. Thank you, Pilar. No one does it quite like her. Let's see, we're going to go into introducing our panelists. I'm going to go a little bit out of order because I have an emergency note coming from one of our panelists, Aki. Aki, thank you so much for being here. She's dealing with a family medical emergency and may be called to go to the hospital at any moment. So I kind of want to move her up in the program if that's okay with everybody. Aki Soriano is the Executive Director of the Filipino Workers Center. If you want to say a few words.
Sure. Hi, everyone. And thank you so much. So as the Executive Director of the Filipino Workers Center, we represent so many home care workers, those who are domestic workers caring for elders in their home, also in the small facilities, the residential care for the elderly facilities. And so it's really, and a majority of them are undocumented. So just feeling both, even those that are documented, the need for healthcare, and just how we saw over this last, over the last pandemic, over this last year, how we see that when not everyone has access to healthcare, how that really impacts us all, right? I think it's just even looking at domestic workers who are working, providing home care, but then don't have health care for themselves and working around the clock. They develop so many long-term chronic diseases. And so this just results in such a travesty in this country where we are, one of the richest countries in the world, and here in California, that we can actually provide healthcare to everyone, and having healthcare that would prevent those long-term chronic diseases that made so many of our members vulnerable then to COVID. We lost so many over this last year. It was just such a hard year, and so, and then we saw how it impacted that, our elderly population too, especially in these homes. And so, we have to create equity and of access to healthcare and home care, I would say as well, so that we can all have, equal access to, living lives that have dignity. And this really isn't a situation where we can only provide healthcare actually to a few people. We can see with what Pilar said, we can actually do this for our whole society, including undocumented immigrants. I think you may have heard of the announcement of Medi-Cal being expanded to all undocumented eligible seniors here in California. So that's such a right step in the direction. And we just got to keep on continuing to fight, because especially now with the pandemic, it just laid bare how the inequities in our society actually come down to life and death matters. And this actually was the situation of our community even prior to the pandemic. It's just the pandemic lifted it up more with visibility, because we had domestic workers dying, because they didn't get enough sleep, because of these chronic diseases, just how they were impacted on the health side was already disproportionate. And then now with the pandemic, we just see how, how much that inequality, it just brought it visible to our society. So I think we need to embrace it. That's just one example, and it disproportionately impacts so many different communities and individuals. So we got to stand together to fight for Medicare for all.
Thank you, Aki. PwC does amazing work, and with such positive and great spirit, and your leadership's valued. Thank you for being here. We'll go ahead and go through the panel if you can stick around as long as you can. Next, I'd like to introduce Ada Briceño. She is a co-president of Unite Here, Local 11, chair of the Democratic Party in Orange County, and she is also a DNC member. Ada, would you like to say a few words?
I would. Jenny, thank you so much for the invitation. I can't tell you how important it is for me to be here with all of you. I wish so much that I had a young group of labor leaders when I was growing up. I started my work in the labor movement when I was 18 years old. And at 26, I became the principal officer of my union. So having this group is incredible. I'm also very thankful that Zoe and Tomasina are here and just really enjoy the fact that we have courageous women who are standing up against these large corporations. But in any case, just a little bit about me. I'm an immigrant. I came here when I was 6. In addition to being one of the co-presidents of my union, I'm also on the National Steering Committee for the Labor Campaign for Single Payer. And I'm learning a tremendous amount, being there and being able to speak to different people about why Local 11 believes in Medicare for all and why we're standing strong despite many other unions not getting there. So I'm excited to have a discussion about, why we're there, why we believe in it, what we believe are the stumbling blocks, and really learn from all the rest of the panelists also how to get ahead of this and organize ourselves. I believe we can do it in this country. I believe in this country to take us through and really protect our health and our human rights. So thank you so much for having me here, Jenny, and I look forward to the rest of this discussion.
Thank you, Ada. Unite Here 11 doing incredible work, both at the Democratic Party and the grassroots level. And you have not been shy in either space to say everyone needs healthcare. We need single payer. You stand tall, even on Zoom, wherever you go. Thank you so much for your leadership. Our next up to introduce is Assemblymember Kalra. He's in District 27, the San Jose area. He is the lead author of AB 1400 and the current chair of the California Legislative Progressive Caucus. Assemblymember, would you like to say a few words?
Yes, thank you all so much for inviting me. I have great admiration for the LA young workers and your activism and your desire to really bring all of us together from around the state. Many of whom I see, all the panelists that are here with me, many of whom have been working for many, many years to bring single payer healthcare to our state, our nation, and to make it a reality. We know that this has been really a battle, decades in the making, and we are taking up the challenge right now. And I think it will be irresponsible for us to not do so. But we do need to be not just courageous, but thoughtful and find a way to understand that the forces against us, as some of you have already said, we know how much they're profiting off of us. We know what the forces against us are. So we also have to combat those profiteering forces with justice and with love for each and every one of us, for those we don't know, for those that don't have a job, for those that don't have a union. And that's why it's so wonderful to see the labor movement really start to get energized around this issue, to have leaders like Ada that are very clear on where they stand. I love Unite Here because they push forward a movement of justice. And there's no doubt that the fight for healthcare for all, everyone in, no one out, is a movement of justice. And so I was very excited to see earlier, or last month, I guess it was now, that the Labor Federation at their annual meeting prioritized AB 1400. And even Robbie Hunter with the building trade spoke very passionately about the need for us to move towards single payer healthcare. Now, all of us here know it's a lot easier said than done, but we've got to do it, because if not us, then who? And I've said this oftentimes before, that look, we all have our roles to play for however long we have those roles. And, I have my political mortality. All these young people that are here are the ones that are going to take over for us. And I want to leave them a better world. I want to leave them with healthcare, and I want to do it together. And so I'm excited to be here, with such extraordinary panelists, and look forward to hearing from them as well.
Thank you, Assemblymember. I think it does take courage to introduce a bill and really champion it. And it sounds like AB 1400, as you mentioned at one point, will be the first to have financing, potentially, hopefully. Thank you. Next, we have Michael Lighty, President of Healthy California now and former Policy Director of California Nurses Association and National Nurses United. Michael?
Thank you, Jenny, and thank you, the Young Workers Los Angeles, for hosting this forum and for including me. The sun is coming in here kind of oddly. Today it's the sun. Yesterday it was a earthquake, so I guess we should be grateful for just the sun. My experience in the labor movement over 25 years at National Nurses United convinced me of the central role that workers play, obviously nurses play in the healthcare system, but workers in general, in terms of the sacrifices that we've made to secure the health benefits that we have, and the desperation that we face when our families and communities suffer at the hands of this murderous healthcare industry. And I think we have to call them out for what they are. They are as toxic as tobacco, as the tobacco industry. They are literally profiting off of human suffering, and it's morally repugnant and unacceptable. And we often talk about our movement as a movement to save lives. It is also a movement to secure our future, because if we keep diverting the literally hundreds of billions of dollars that Californians pay to the healthcare industry, instead of the human needs to provide living wage jobs, to provide guaranteed homes, to address the climate crisis, we simply will not have the resources to really affect the social transformation and actually address the social determinants of health, which is at the root of so much of the suffering that we've seen. And the pandemic has revealed the importance of public health and the addressing of these chronic conditions and the huge and fundamental healthcare inequities that exist in the system. It is only through this fight for Medicare for all that we're going to be able to address this. And the leadership here that you all have gathered, I think, is profound. I had a great admiration for what ADA and Unite here, Local 11's doing down in Los Angeles, and for the other labor leaders, and especially for the young workers. I've had the opportunity to work with Democratic Socialists of America, which has been my political home since 1982. And many of the new generation of DSA activists are young workers. And it is such a profound inspiration to work with you all. And I was reminded of the importance. I read a recent article about Amazon organizing in Bessemer, Alabama. And there was a generational divide. And the generational divide was between older workers who generally were pro-union and younger workers who were not. And that tells us the profound challenge that we face, the importance of your work in securing the future for this country that is actually livable and secure, and that we do save the lives and secure that future. So thank you so much for having me.
Thank you, Michael. You've worked on Medicare for all. You're one of the leading experts in the country, and you've done it for decades, but I'm always surprised by how engaged you are at the grassroots, like, grassy roots level. So thank you for being here. Next, would like to introduce Mark Ramos, UFCW Local 1428 President, and also my Regional Director, Region 11 for CDP.
Thanks, Jenny. Good evening, everybody. It's wonderful to be here with everybody. Listening to these stories, it brings back a lot of memories, but also, I think stated earlier, talks about the incredibly complex and diverse healthcare system that we just have within labor, and how all of our unions see healthcare and how we bargain it. But I'm a true believer in the fact that I really think that there's a space for labor to really kind of lead on this issue, if we can do it together, and really find a space. It was I worked in I've been in the industry for 34 years. I worked in the grocery stores for 15 years. And one of the first big things that I did when I got here to 1428 as a young organizer, we went on strike for 4.5 months in 2003, 2004. And the basis of that strike was healthcare. And, you know, working in the stores for 15 years, I had great healthcare, right? But the strike really showed me how vulnerable all of that is and how easily it can be taken away or attempted to be taken from us by greedy employers. And it's really kind of given me the kind of the perception that we have to do better, right? And as we begin to kind of do all of this intake, you know, a few years ago, we had a bill in Sacramento, AB 880, that would have held large employers accountable for put employees onto the public rolls and to a massive savings to themselves, right? And would have made them reimburse the state at 100%, 110% of the commercial cost. You know, in UFCW for us here at 1420, it's a big deal, and actually led us to kind of stick our neck out and take out a sitting assembly member in AB 47 over that issue. So, you know, my union, UFCW, is not, you know, I don't think we've taken formal positions. I have. I'm unafraid to let folks know where I stand. But Jenni and I have talked, and I know I've talked to him. I see Ron, my brother Ron Birnbaum on here. That it is a complex issue and is a big hurdle for us in labor because there's a lot that we have to get over, right? We have to mentally get over the idea of giving something up to get something. And when I say give something up that we've fought for, and unfortunately in 2004 that I saw people die for, you know, and coming through this pandemic, even our members who have healthcare because they were working, and it's all based on hours worked, but even them trying to access healthcare during the pandemic and how vulnerable everything was and how, you know, just the whole system is almost like a house of cards because as more people are getting older, there's fewer younger folks coming into these systems to pay for everything. We really seriously have to figure this out. And I think, as Mr. Lighty said, really the core of all of this evil is profit. I think it begins and ends there. And once we begin to attack the profit stream, then it allows us to really kind of sit down and begin to have these much deeper conversations about what access for all looks like. And to be honest with you, Jenni, I'm more excited to sit here and learn from everybody than to talk to folks because it's a wonderful panel you've put together. And I really appreciate the opportunity, the invitation.
You are not off the hook, Mark. Your view is so important. I appreciate your honesty here because your vantage point helps us figure out how to solve, you know, come up with a solution, solve the problem, the hurdle. You've worked on hero pay and, you know, you've really held the door open, I think, in the democratic space so that we could, you know, push AB 1400 resolution. And, you know, you were one of the authors on it in our district. So in every way that you help, thank you. Your union may not be on board to see you out here. I don't know if you're going out on a limb, but it's nothing to take for granted. Thank you. I was going to introduce Aquilina, but she did get called to the hospital. So thank you for letting her speak earlier. Analisa Swan, she is a workers' compensation attorney with Ford and Wallach, and she works with Teamsters Local 986. There's actually a lot of cool things I could tell you about her, but I hope she tells you herself.
Hi, good evening. My name is Analisa Swan. My pronouns are she, her. I identify as lesbian in the LGBTQIA community. So happy Pride to everyone. I'd also like to give a land acknowledgement that I'm presenting from Burbank, California, Tongva land. And I share this space with so many awesome activists. Mark is also my region director for Region 11. And I'm an Assembly District delegate, elected delegate to the California Democratic Party for Assembly District 43, Laura Friedman's district. So I'm a delegate to the California Democratic Party along with Jenni Chang. I love everything that the young workers are doing here. I know one of the founders, Carla Salazar, from being friends with her in the Coalition of Labor Union Women. I'm very active in the labor movement. I'm a past secretary of the Coalition Labor Union Women. And I see some of my great sisters from what we call CLUE here with us tonight. I am an attorney. I represent injured workers for California workers' compensation, and I'm an attorney with Ford and Wallach. We're one of the oldest workers' compensation firms in the Southland. Our firm was founded in 1953 by labor leader Abe Levy. We only represent workers. We've never represented any employers or insurance carriers. So we're 100% focused on workers' rights and fighting for workers' benefits through the California workers' compensation system. I've been with the firm since March 8th, 2004. I love what we do. We're helping people in the hardest times, a lot of times in their life, where they've had a serious or catastrophic injury. And I've been marching for Medicare for all since 2017. I came into it kind of like in 2016. I became a really fired up grassroots activist. And that's kind of where I really went to like a next level of activism. And I just realized we can't take things for granted, especially working in a space where we're litigating for healthcare benefits through the workers' comp system. I've seen the fight that people have to go through to get just basic medical coverage, and we do a great job with that. We help people through a difficult system, but honestly, it shouldn't have to be that difficult. And I also see the overlap of how hard it is to get qualified for things like Social Security, disability, and Medicare. We really need an expanded Medicare system and things like Medi-Cal. And so I'm just really proud to be here fighting tonight for workers' rights and to be part of this awesome group of presenters. Thank you.
Thank you, Analisa. May I talk about you being a DNC delegate?
And I'm also a DNC Biden delegate, which is just kind of proof that like, I think Medicare for all single payer, like it spans the entire political spectrum. Like you really can't make assumptions that like someone's going to support or not support universal health care just based on like how they voted or like where they may fall in the political spectrum. So there's that too.
Thank you. I value that so much. Depending on what space you say that in, you know, people want to take ownership of a movement and they're like, Biden, use for a public option. And you took some hits, and I watched you handle these kind of wild sort of interactions with such grace and sticking to the issue. And, you know, you're going to expand the movement. Thank you for being here. Let's go into discussion. We have a really great sense, I think, of our speakers tonight, right? Really wonderful speakers. Thank you for sharing so much about yourselves tonight. So kind of want to, you know, we had the community speakers earlier, and we heard from Thomasina and Selena. I want to hear from our panelists a little bit more about the worker and organization struggles you'd seen during the pandemic. I could call on someone, but if anyone immediately feels compelled to speak, please feel free.
I'm happy to speak.
Thank you, Ada.
Yeah, so thank you for the opportunity. So right after the pandemic hit, in a week and a half, you know, our members went from being at the top, the industry, the tourism industry went from being at its best to then laying off over 90% of our workers. That's 90, not 19, okay? And to date, I think we're lucky if we have 25% of the workers back. So we still have a large base of workers who are out, slowly but surely coming back. But many of you will understand that the tourism industry will not return fast. It'll take time. We don't think that we'll see a strong return until 2023 or 2024. Therefore, the thing that we worried about the most, in addition to getting the virus, was whether or not the members of our union and their families would have health care. So I worried about it. The leaders of the union worried about it. The family members worried about it. The member worried about it. And we had to negotiate with over 156 different employers, you know, and 2 or 3 months at a time, because nobody knew where we were going and how we were heading. So it was constant worry, mental health issues related to that. Will we have, healthcare in the most important time We've worked so hard to protect and have it, and now will we have it, or will the employer yank it from us, right? And so for the most part, about 60% of the workers, we were successful, but not without a fight. We had to do car caravans. We had to pressure the boss. We had to put him on blast, right? We had to go to the press. That was the only way 60% of our members were able to return or were able to keep their health care. As you know, the rest of the industry, if union workers didn't get it, you know that the rest of the industry did not give it to their workers. So, but we organized one employer at a time, one member at a time during the most vulnerable time in our lives. And so that's why we should not have healthcare tied to a job. For many, there's so many reasons why many of you know, but especially now, having that my job be tied to my healthcare has been dangerous. It has costed lives, and it's got to stop. Thank you, Jenni, for letting me tell you about my union.
Wow. I mean, I hear the frustration, 156 employers. It's a lot of work, especially during a political time when we were all already exhausted.
Yeah, if I could add to Ada, and you know, of course, we stood with Unite here, the hotel workers, and that's a perfect example that you could have a great contract with great healthcare. Your job goes away, and that all goes away in a flash. And so, absolutely, I think what I oftentimes say is the COVID pandemic has not created inequities; it's exposed them and exacerbated them. And I think that is true for workers across the board. As you know, those in Silicon Valley and other parts of the state were making record profits, we also had record long lines at food banks. We had, you know, we had directions and guidance from public health departments that so many of our families cannot abide by just because they don't have the wealth. I have families living in my district, 3-4 families in a home. You tell them to socially distance in that situation when they all have to go to work every day. While so many of us are able to stay at home, you have the workers that had to go out there so that we could stay at home, and they go back. The zip codes with the highest rate of death in the Bay Area are in my assembly district in East San Jose. That's where the workers live. Heavily Latino, Vietnamese. They don't have the luxury of staying at home, and they don't have the luxury of when they get sick to have their own bedroom to themselves to get better. And so we have to recognize that if you look at the data, the number one profession that's died through COVID are cooks. These aren't cooks at 5-star restaurants. These are McDonald's workers. These are fast food workers that are dying. UFCW workers that are working in the grocery stores. They didn't have a choice. They had to go to work so that we could feed our families. Farm workers. And so the fact of that, not only did the workers have to put themselves in that kind of jeopardy, but that so many of them didn't have meaningful access to healthcare on top of that. The ones that had unions, at least they had healthcare. Think about all the so many that don't have that access at all to healthcare, or not meaningful access. That can't afford to pay for the treatment. Yeah, the vaccine's free, the treatment's not, right? And so think about all the people that have died when there's a labor shortage right now, because first of all, employers aren't willing to pay enough to actually get workers back into a very still unsafe environment. But you know, it's not a labor shortage. What it is, it's the greed of the employers not willing to pay what the worker is worth. But on top of that, 600,000 people died. Who do you think they were? These are the workers. Even those 65 and older, they say, well, most, you know, half are 65 and older. You don't think 65 and older are working? Have you seen our communities? People can't afford to retire in working class communities at 65. And so I mention all that because we came together as a country, as a state. Let's beat this virus. Let's beat this pandemic. And we've done a pretty damn good job of that. But what we haven't yet recognized is the fact that so much pain was unnecessarily caused. As Michael said, you know, there is blood on the hands of those that continue to push forward a for-profit industry, especially in and coming out of this pandemic.
Thank you, Assemblymember. Mark, do you have any thoughts?
Just, you know, Assemblymember, you know, from us in the UFCW, I want to say thank you, because we pushed really, really hard on a lot of workplace protections. You know, we went from the beginning of the pandemic, where we actually had employers telling our members not to wear a mask because it might scare the customers, right? To where we have an employer that that operates here in Southern California. Kroger operates Ralph's and Food for Less. Food for Less is predominantly in Latino communities or communities of color, and how from the very beginning, how the two stores were treated differently, or how they treated their employees differently, right? Where immediately the Ralph's were operated from hours of 8 a.m. to 8 p.m. and they were going to do it company wide. But almost within a couple of days, they started extending the hours at the Food for Less stores because the non-union ethnic markets in those neighborhoods stayed open later. So they felt they had to compete. And I remember being on a call with the head of Kroger's labor relations department in Cincinnati. And I told him, I said, so in other words, what you're telling us is the rhetoric is true, that it really is profits over people, right? And to hear the silence to the point where they actually asked my regional director for the UFCW, they asked that they didn't want me on the calls anymore because it was more of a, I was unafraid to tell them that, look, why should the city of Pomona, which has a Food for Less, why should those workers in that community be treated differently than Newport Beach, than the Ralph's and Newport Beach workers, right? But there was a lot of hiring that also went on. We had a massive influx of new members in the UFCW, but a lot of them didn't qualify for healthcare right away. So when they got sick, we had to figure out all these different plans and ideas. And that's where the assembly, the members of the assembly and the state legislature and the governor were extremely important, because they did fill a gap for us. Because the employers started collecting data when they were asking our members, well, where do you think you got sick? Because they didn't want to have the responsibility, that they wanted to be able to say, well, Jimmy didn't get sick at work, Jimmy got sick at home, right? Not knowing, as the member said, that Jimmy lives in a house with 8 people and everybody works in some segment of the service industry, right? And they're all exposed. Again, it just, and our members literally working in a petri dish, right? For months and months and months and months, the only place that a large crowd could legally gather was a grocery store, right? And then our members having to fight with customers, our members being put in the middle of the company policy, which says that they're mandating masks, and then they tell the workers at the store, oh yeah, we're mandating it, but you can't enforce it, right? All of the rhetoric that goes back and forth was extremely tiring. And even to this day, I think our members, I was just reading an article earlier, that workers are just tired. And a lot of it has to do with the simple fact that we're taught in our industry, and Ada is probably the same, we're taught if you don't feel well, it's okay, go to work. It's just the sniffles, you'll get over it, right? It's no big deal, right? And we've taken a much different position, and I think we need to be more aggressive. And I think if we had a healthcare system where people didn't have to worry about going to the doctor meant I would be late on my rent, right? If going to the doctor didn't mean that I wasn't going to have money for electricity bill, if people just had that security, I think that, by and large, we'd probably see very direct results of a much healthier society. And I think that, again, as someone said earlier, the pandemic just exposed a lot of the inequities and the vulnerabilities of our healthcare system, and doing something to structurally fix this goes a long way to creating, as we set out in this country, when this country started, right, to be a more perfect union, right? Going to fix those things puts us on a path to being a more perfect union. So.
Thank you, Mark.
Jenny, can I just jump in
Yes, of
quick?
course.
I think we have to honor the experience of Thomasina and Selena, and also what Ada and Mark have said. And it's really great to hear an elected official like Ash who gets it. And, just to bring in what I think is obvious is that workers were told to sacrifice their lives for the economy. They were explicitly told that. They were told that by elected officials, and not just Republicans. Joe Manchin said it. We got to get the workers back to work for the economy. And if there is a worse example of exploitation in recent memory, I don't know it. That literally you put your life on the line so that these guys can make a buck, and you sacrifice your health, as Mark said. And hell no, they don't want to hear it. And that's why it's so important that we say it, and that this kind of organizing among workers. And then on the other side, the experience of the hospitality industry is, yeah, you lose your job, you lose your health care. So which way is it, right? You have to go to work and then you don't have a job. And in both cases, you're not protected, you don't have security. And I think that there is therefore the call for systemic change. And it starts with healthcare and changing healthcare to a public good. And that should animate our vision for all human needs and how we address them. And I think labor and young workers have the central role to play in making that social transformation.
Very well said. If there's no other comment for this part, I'd like to ask, what the difference between a union that supports Medicare for all versus a union that doesn't. What's going on? Is it is it grocery store owners are conservative and hotels are not? What is the difference?
I'll say something because Mark referred to it. I think it's absolutely legitimate that there is legitimate fear and understandable fear. If you have something right now that's working, and that's why you see a lot more of the public sector unions hesitate, because I can tell you, I was on the city council and I've stood by my unions from day one, especially when there was unilateral attacks against them in San Jose a few years back. And they fought so hard for what they have. It's very scary to say, okay, we're going to give up what we fought for years, for decades, to have quality healthcare so that I don't have to worry if my kid gets sick or my kid needs braces, or if I get sick, if I get cancer, I can get treatment. And so I can definitely see the distinction between those unions that have more private contracts, that they have to really push to even get the bare bones minimum, as opposed to public contracts, where oftentimes they do get a really gold standard type healthcare. Shoot, we get that in the assembly. Our assembly staffers thankfully have great healthcare, and that's a good thing. And so I think that and others, I don't want to monopolize, but I see a distinction between those that rely more on contracts with private entities and public entities, where those that are public employees tend to hesitate more towards moving to a single payer because they're giving up a lot that they understandably fought for, and we have to be respectful of that. And I'm the chair of the labor committee. I will not do anything that's going to be bad for workers, but I don't expect people to just take my word for it. This is going to be something that trust is going to have to be built one step at a time.
Yeah, and I would say that, and just for a lack of a better phrasing, this is asking some folks to take a leap of faith, and that's how they see it, right? And that can be scary, because we could work really, really hard to institute this, and the political winds could shift, and it could be repealed, right? And then suddenly, what we walked away from, our Taft-Hartley Trust Fund, suddenly we're trying to rebuild something from the ground up. And is it going to take us another 70 years to get them back to where they are, right? So, Jenny, I think I mentioned this, Jenny mentioned others, that I would really, really like to see, and Assemblymember, if there's that, I think one of the things that we really have to do is work towards enshrining this right? And if that's a statewide, in putting in a state constitution, right? Whether it's a ballot measure or whatever, putting in a state constitution that healthcare and access to it is a human right for all Californians, documented or undocumented, right? Because then I think it brings some kind of security to the idea that it's not just something that can be changed if we end up with another Arnold Schwarzenegger, right? And the damage that he did to workers' comp, right? I think that is just a fear for some folks. And look, I'm gonna be honest with you, I'm gonna say something here. That there are some political leaders who are also afraid to stand in front of their members and say, this is a good thing, because tough conversations can be hard to have sometimes, especially when you're talking with a very vocal group or a group of folks who, you're asking them to give something up as they see it. It's not necessarily that it is, but it's the perception of it. And to a lot of folks, whether we want to believe it or not, perception can become reality when it comes to the optics of things.
So I'll just say that so much to say about this. I just have so many feelings. Where do I start? So I'm not going to pretend to understand everything or speak on behalf of my brothers and sisters who I respect a lot and their stance on it. But I can tell you that, I've been in the labor movement for 30 years, in different positions, negotiating as a worker, you name it. And synonymous with the word union was healthcare. It is the crux of our contract, along with respect and wages. It is so crucial, and we have taught our members to guard it with their lives, to put their to put their job at risk for it, so we can fight for it, to get arrested for it, to do whatever it takes for their families. And it's been a part of our organizing strategy, from the minute we wake up. Okay, so when we organize so strongly around it, and it becomes, a beautiful benefit at very small cost, a Cadillac plan, at least for hotel workers, even though we may not have the Cadillac plan. For us, it's our Cadillac plan, right? Because the rest of the industry does not have it, right? And it gets in the way of whether or not people move towards their dream job in the future, because they're holding on to their healthcare here and putting up with all these difficulties and not following their dream. So it was really difficult to come to the decision, that we've got to, make a determination that, holding on to healthcare for a very few, amount of people, it doesn't make sense. It has, in my opinion, held back the whole labor movement. At least in my experience, as an organizer, it holds back, so much. Every single fight that I've been a part of, most of them are around healthcare. If we take that out of the equation, we can fight for childcare. We can fight for pensions. For God's sake, we have, 75, 85, year olds that are still working, washing dishes, cooking, setting up tables. We don't, the members of our union, they have to stay there and work because they depend on that paycheck in order to survive. So it is such a difficult thing, but it's held, I think, the labor movement in general for fighting for social justice, because we're so entrenched. I can tell you, my union did not feel like we had a voice in the system because we had our heads in the sand fighting for healthcare. So we weren't in the middle of thinking about innovative ways that we can unclog our system, which is by giving others, and fighting for Medicare for all, so we can, clear the field and fight for all those things that we know our country should be offering, everyone. So I don't pretend to understand other people's reasons, but there are infrastructures that were created in the Taft-Hartley funds. And there are relationships that are formed with people in those Taft-Hartley funds. They're fantastic consultants that are making their ways through different relationships up and down, the union movement. And so, it is somewhat scary, but you know what? The labor movement has risked so much, so many before me. I stand on the shoulders of so many people who lost their lives to have a voice and to give me the strength to fight for, to fight with other working families. And so, we came to the conclusion that no relationship, no structure can hold back, our union, our members from understanding that we have to fight for everyone so we can be successful. That, that these for-profit corporations, just like, in the healthcare industry, they're just like the greedy Chateau Marmont. They're just like the greedy, hotel employers who took all those PPP monies from the American people when they weren't employing their people. So there is just so much emotions around this, but I do believe that it's important to us as advocates for Medicare for all, even though we may not have unions lined up, that we can't demonize them, that we have to speak with our heart and change the hearts and minds of the workers, the general public, and they've got to be able to see our roadmap. I was always, I always supported it. I didn't know that, hearing Dr. Bill in Orange County speak endlessly about Medicare for all was going to have an effect on my voice, but it did, right? It did. And I said, I too can have that effect on other people. So we've got to remember our endless power of educating one person at a time and getting them on our corner, because that's the only way we can win. And that's the way that our union taught me how to fight on all these social justice issues, primarily now using our voice to fight for Medicare for all.
Wow.
I just wanted to,
Yes, go ahead, Analisa. Thank you.
that was just awesome. But I just wanted to say, I think there's also some labor education that we need to do. Like one of the things with the Coalition Labor Union Women, it's like teaching the past history and the struggles. Like I see the labor movement as being fully intertwined with all other areas of civil rights and justice, racial equity, LGBTQIA rights, women's rights, all of those, and the healthcare justice movement, all of that being interconnected. I learned about Medicare for All through Labor United Healthcare, Universal Healthcare, from nurses that were part of the Coalition Labor Union Women. So I think if we can bring in some of that education and training to union members about healthcare, and that's a way to bring more union members into the movement. Thank you.
Let's work on that. Educating unions. Let's work on some materials. Well, maybe Mark, we can work with you. Otto, we can work with you.
Can I just jump in quickly, Jenny?
Sure, of course.
Because what I've heard here is validates what I think we have to do. And just as Analisa is saying, it's an education project. When I've met with workers, stewards who don't necessarily come in the room supporting Medicare for all, they want to know how it's going to affect them directly. They want to know specifically what it's going to cost them, what benefits they're going to derive. And unless we're able to tell them that, I don't think we're going to convince them, frankly. And there is, as Mark and Ada have said, and Ash as well, that these workers have given up a lot and they follow this quite closely. And the details matter to them very much. And because the situation's so desperate, they know this, they know the score for their friends and family who don't have the union health plans that they have. They're desperate to keep what they have because the alternative, in their view and their experience, is so much worse. So we have to respect that, but we can't just expect them to take our word for it. As Ash said, we really have to show our work. We have to show them directly and have answers. And it's much easier, as the sociologists remind us, to focus on what you're going to lose than to believe in what is promised to you. And until we reconcile that, I think we're gonna have a hard time. I think structurally and systematically, we used to always believe that if we moved the unions, that would move the Democratic Party in particular. I think we're also seeing the alternative, is that when President Biden or other Democratic elected officials oppose Medicare for all, that sends a signal to unions who are particularly engaged in Democratic Party politics that they shouldn't support it either. And so we also have to overcome some of that linkage. And ultimately, I think it's going to be about the costs. And it's not a sustainable system. It's not a sustainable system for the trust funds. It's not a sustainable system for the employers, frankly. No. If there's like hotel workers, if they're starting to pay $11, $13 an hour for health benefits, and you see that in the trades as well, what's it going to be in 10 years? $26 an hour? It starts to dwarf the wages. And so we're in a train wreck here economically and fiscally. And that's why we have to, it's urgent that we actually solve this problem at the system level and convince folks, literally workers individually, why it's in their interest to join that demand for systemic change.
And we have to have those tough conversations amongst ourselves. You know what I mean? Look, in the UFCW, my local, 35% of my membership are registered Republicans, right? Selena, IBEW, right? Those. So it's not like when we talk about the unions, it's not just the UFCW is just this one big entity. The UFCW is 1.3 million people, right? With all different opinions and life experiences, and we have to chase those hard conversations, right? You know, I have members who don't want to get vaccinated because they literally think that it's going to change their DNA, right? All our members are no different than the general public at large, and we have to have those tough conversations with people, and we have to pursue the tough conversations with people, and we have to do it amongst our membership. Amongst the leaders is great. It's fine. It's fine to have those conversations. Ada and I can sit down and we can go back and forth about how those, you know, and at the end of the day, we've got to get deep down into our membership and get to those folks who aren't believers. And we have to, it's not a conversation about a Democrat or Republican issue. Because as soon as you say the D or R word, the wall goes up and nobody wants to have that conversation, right? Because they feel like they're being attacked. You have to get to the core of the issue, the complexity of it, and break it down to them and show them where the benefit actually lies for them. And I've been doing this for so many years here at the local, because I was always in charge of raising money for our political PAC. You know, and chasing those members who identify as Republican, you know, and getting them to contribute $1 a week to our political PAC based on issues and not a party has always showed me that if we focus on the issue, we can actually move something. But I would encourage everybody here, let's not just talk to each other. Let's go out and have those hard conversations. Selena, go talk to those guys who have the Trump stickers on the back of the truck, right? We have to have those conversations, because if we're honest with ourselves as labor, it was union members who elected Donald Trump. If we go back to Michigan, Ohio, and Pennsylvania. So again, when we talk about unions, we're not just a cookie cutter, and we're should be diverse. We're diverse individually as unions with all of our different acronyms. And then even deeper down, when you get down to the membership, we break off into so many different subgroups from there too.
Very important points, Mark. Thank you. We have a hand up. We want to end at 7:30, so we're going to skip part of the agenda, and I want to cover some of the strategies. Wendy Ruiz, and then I think Bobby, you also had a question. If you can unmute Wendy and then Bobby.
Hey guys, can you hear me?
Yes.
I really just wanted to thank everybody for all of the work that they've done for medical coverage for everyone. I have so many stories about people in my everyday life, and I'm almost embarrassed to say that I live this way, but I am usually not emotional about a lot of things. I can speak to things pretty clearly, but this in particular does, because people are paying with their lives. And my daughters lost their dad because he had health issues, and instead of being able to pay for medication, he wanted to make things last. I can't stress enough the importance, the anxiety, the frustration, the fear that comes from wanting to seek out medical attention sometimes, knowing something's not right with you, knowing that you're not okay, and being so afraid of the cost and the burden that would put on you and your family that you decide that you don't want to go be treated. This is real for so many people that I know that are saying I can make my insulin last a little longer. I am really encouraged by everybody that is here today. I've been very fortunate. My last job was with Fire and Police Pensions with the city of LA. I am currently with IBEW Local 18. And I have such great healthcare. I always walk into rooms and say, labor jobs save lives. And the reason why it does that is because it provides us with healthcare. I'm a single mom of 3 kids, and I didn't have to fear taking them to the doctor. We've lived our whole life like that. where they don't even want to tell me what's wrong because they know it costs something. Now I have to talk to them and say that that's not a concern that they need to have anymore. These are children and they know that and they understand that. For me, it's so encouraging to be with a group of leaders like you guys who are fighting for this. But I also wanted to use the time, you know, for us to remember that we are now part of these unions. So although, you know, there may be other people who don't agree, we're now in these positions to start having these conversations on the inside and to start pushing and to start making, you know, headway. And it really is all like up to all of us. I work in a yard. I'm actually still here. And all these guys that I talk to, these are guys who are climbing poles, who risk their lives every day. The most important thing to them is their healthcare. When I worked at Fire and Police Pensions, anytime that we had a board meeting, do you know what they thought about? Their healthcare. Because they knew that one of the reasons these guys stayed in their jobs for so long was because they didn't want to lose their healthcare. I think we all value life and we all value the quality of life. To say that someone doesn't deserve to live because they didn't have the right job, or they don't deserve to live because they don't make enough money, is inhumane. And so to all of us that are in here today, thank you so much for, I mean, Jenni, all of the young workers. I'm so proud of all of you guys. Thank you guys for all the work that you do, and anything that you guys need from me and from people like me. Like, I'm not afraid to knock down doors. I'm not afraid to talk to anybody, Trump supporter or not. In fact, those are the favorite ones, because it's those guys that make the difference. I don't want to talk to the people that agree with me. I want to talk to the people that don't, because those are the people that we need on our side. And so I just want to thank everybody for being in here, and to encourage everyone to remember that we're in here now, and we may be young, but we have a lot of shared experiences, and it's experience that makes all the difference. Thank you guys so much for everything that you do. And, you know, I'm in solidarity with all of you guys. Thank you.
Wendy, we are with you. I'm so proud to run on a slate with you. You always inspire when you speak. Thank you so much for sharing your voice here. And thank you for your leadership. Definitely we need to loop you back in and get you connected to this movement, speaking out. Thank you. Bobby, you had a question or comment?
Yeah, you know, some of it was kind of answered, but just, you know, thanks, Jenni. Thanks, Linda. Thank you, Wendy. Always inspirational. All these leaders that are on here, the panelists. I guess just I'll kind of skip to the first part, because the second, the initial question was answered. So I'll skip to the second. And that's, how do we convince, you know, the corporations, the owners, look, this is good for you too, you know?
Yeah, if I could, well, first of all, can I just say Wendy's amazing, and can we just like have her as a spokesperson at everything that we do regarding single parent? She was fantastic. And I'll say two things to this, because I do, this comes up a lot. The trade industries are going to be against single parent every time. Chamber of Commerce, here locally, the Silicon Valley Leadership Group. But to what Michael said earlier, this is actually really good for employers. If you actually look at the numbers, employers across the board would save money under single payer. But the problem is the health insurance companies and hospitals, they're all members of these trade organizations, and they pay big bucks to be like platinum level members of these associations for the very reason of influencing these large entities to fight against single payer. Because at the end of the day, the Chamber of Commerces of the world, they don't mind a concentration of wealth and power to them. And they don't, you know, even if it means that people are going to die. And so I think we've got to do, again, the education is critical at the ground level. Go to your small businesses, your small business associations, your minority Chamber of Commerces. Go to them. Do not discount them just because the big associations opposing. Go to the smaller businesses. Go to the companies. Go to some of the tech companies, wherever it takes, and talk to them directly. Ask them, how much you're paying for healthcare, and they'll tell you it's astronomical. And so it's a one, just like we have to convince one person at a time, we've got to convince 1 company at a time, one CEO, one COO at a time to get on board. And it takes a lot of work to do it, but that's how we combat the larger entities that we already know are going to be against us day one. And the second thing I'll say that Wendy put in my mind here about young people, that this is, we're here at the LA Young Workers event, and young people, and they can obviously correct me if I'm wrong, but young people do think more socially about other people than themselves, far more than the older generations. And that's a good thing. And it's because they're suffering through decisions that have been made to squeeze them on student debt, on housing, on medical. They realize there's a better way. And so we've got to ignite the young people to lead this movement, to lead this army, and to help convince people one person at a time.
You're muted, Jenny.
Thank you so much, Assemblymember. And Linda, you have your hand up.
Oh, I did.
Yes, thank you. Thank you for giving me 1 minute. I just have to say, I have insurance. I'm okay, but my insurance is also part of Medicare. So I am under Medicare as well. But, you know, my kids don't have insurance. My son had an emergency surgery and he had to pay $2,500 just co-payment. And just like my kids, like everybody else that doesn't have the insurance, doesn't have a union, they deserve to have health insurance. And I'm hesitant, but I'm willing to give it up, you know, for the good of the people, you qualify, the old people that cannot qualify. Anyway, that's just my 2 cents. Thank you.
That's right. Linda was at the forum meeting this morning, which is the retirees group of the Labor Federation, and she was getting into it with another retiree who has really great health care and was concerned because they're about to go into bargaining. And Linda spoke out and said, "Why are you so selfish, basically? Don't you want everyone to have health care?" Let's see, we're at 7:30 right now, which I would really like to end on time, but that's not possible. Let's cover strategy. I would just like to say a little bit, for this moment where we have these 2 strategies, speaking to a senior recently, senior activist, and spoke about it as not 2 strategies, but he sees one movement. And I thought it was a really beautiful statement, just kind of all flowing from one space of wanting single payer. And we've grown as a movement, and it's gotten more complex as a movement. And I think it's a really special time because it's different that we have these 2 arms where we can really wrangle the legislature and put pressure there. And you can do both. I'm part of an organization that does both, wants to do both, sees the value. The longtime senior activists, some of the scrappiest activists, some of the most sophisticated activists, including former Labor Federation president, who has really good connections with the governor's office. The value of both. We're in a really incredible time right now. Can we do this? Can we not fight each other and fight together? And so I personally support both. And I know the young workers, they're not about infighting. That's why we invited these 2 different strengths to the room, because the bill is important. So is pressuring the governor. And that's a different way to go about it. And it's critical. It's based on what we know of our history of bills here from the States. So I would like to invite Kalra, Assemblymember Kalra, and Michael Lighty to talk a little bit about the strategies and where each is currently at in the process and what to look for.
Yeah, and I'll start by saying I agree with everything you just said, Jenny. I mean, look, at the end of the day, this is a struggle that's been going on for a very long time. And I think right now that we have to be pushing from all directions, up from the legislature, down from the governor. At the end of the day, a lot of people from the governor to a lot of people in the legislature campaigned in support of single payer. Well, we've got to now go beyond just rhetoric to now what are we going to do to show our support for it? And so for 1400, it's a 2-year bill. I think we made a lot of progress in terms of the policy. Been working very closely with the Speaker's office in that regard, and his staff has been wonderful, particularly in terms of answering question, helping with language, what have you. We also do have, although it's not public, we've been working very, very diligently on a funding mechanism as well, which is something that's unique in terms of past versions of single payer policies have been brought forward. So I'm taking it very seriously. I'm taking it step by step in terms of the legislative process. That's why I thought it was important to take these next few months, given what we've done so far. And we have, the policy, we've been working a lot on it, but I think there's a lot of things that can happen. I know that the governor's commission is still going on. I know the governor, the coalition is continuing to, and appropriately so, pressuring the governor to be more and more direct in terms of his asks of the administration. And that's a good thing too, because we need, at the end of the day, something like single payer doesn't happen without the leader of the state being on board and pushing it forward. And so we've got to do, not only, it's got to be like, we have to put all the tools in place for it to be successful, but also the correct pressure points to make sure that we continue to advance both the policy, funding, other components, including the federal support that we're going to need. And I think that, I think you're 100% right, Jenny. I think that we have to do it all, because ultimately we don't know of the different things being pushed, which ones are going to get stalled, which ones aren't. So let's just keep pushing them and recognize that we are all on the same mission. And I think that's the most important part.
Thank you.
I would second that. I think I've always wanted the bill to proceed as a means to pressure the governor, and I wanted the governor as a means to express more explicitly his support for single payer, and actually enact it by engaging with the Biden administration, and that puts pressure on the legislature. So I think that the ultimately the bottom line is there's not really an either or here. It's an and both, as you say, Jenny. And we can, the difference is actually kind of legal and technocratic as to how you interpret when you can formally apply for a waiver. But as a political matter, there can be no question that every time there's a Republican governor around to veto the bill, it will get through the Democratic legislature. And if there's a Democratic governor who doesn't support it, it will not get to his, hopefully someday her, desk. That is the political reality. This is a political struggle. There is no downside to the governor engaging with the Biden administration to help formulate their response, and particularly the amount of resources that they're going to provide to California. And we've got to convince the governor that he has existing authority. He doesn't need to wait for new legislation, which he seems hung up on. Secondly, it's very clear after Dr. Mark Galley emerged so strongly at last Friday's Healthy California for All Commission meeting that he, as the representative and chief policy person for healthcare in this state under the governor, is leading the effort to come up with a recommendation in which single payer financing is the touchstone. And that was the presentation that Professor Shao, who's designed a half dozen single payer systems around the world and worked very closely on Vermont, that was the message of his presentation, is the advantages of single payer. So if you look at this kind of nexus of things going on, it's clear that a pressure campaign to move the governor, an effort to make sure that the Healthy California for All Commission delivers a single payer recommendation, to make sure that people don't just mouth support, as Osh says, for single payer, but actually deliver that support and champion it. And that ultimately will be a political process, perhaps too, playing out in 2022. And we've got to understand, though, that it's very unlikely, as we saw in New York, for a Democratic legislature to move this through to the governor unless the unions are on board. And these are not, the unions are not our opposition. They are the people we need to win over. So it comes back to the young workers. It comes back to education. It comes back to mobilizing union members in favor of this. And so I think that we have spent too much time trying to parse out the legalities of one strategy or another, or worry about what organization is prioritizing what approach. What we have to understand is that a pressure campaign on multiple fronts is the only way we're going to succeed. And finally, we're going to end up on the ballot one way or another. If this were to fully pass in fully funded form through the legislature, the industry will put it on the ballot to a referendum. If we have to go to the ballot in order to finalize the financing, because that's where the voters ultimately have the authority to decide, we're going to be in a massive ballot fight that's going to have taken inoculate voters and educate voters and hold them, because we go in with huge levels of popular support, 85% among Democrats, over 60% overall. We've got to hold that support. And the only way to do that in California is to have the resources to mount a TV campaign, and having waged a multi-year inoculation and education campaign prior.
And to Mark's point earlier, eventually getting it on the ballot and validated by the voters is probably the only way to create the certainty that would be necessary for years and years and decades to come. Because once we give the people single payer and they have it codified as a right, it's not going to be taken away. And that's what the industry is worried about, right? Ultimately. And so I think that, there's no doubt that it's going to be a Herculean effort on all fronts, including, Uber and Lyft spent $200 million to protect rideshare. The insurance company spent over $100 million on pharmaceutical pricing. So you can expect $500 million or more that would be spent trying to prevent us from getting single payer. So we have to be up to that challenge. We have to defeat that, because we're definitely not going to have $500 million on our side, but we don't need it if we're organized enough. We'll need some money, but not as much if we're organized in a way that can't be defeated, and we're marching together.
I love it. This is the most unified front I've ever felt. Look at this leadership. It's my heart. I've always felt no one strategy is going to do this alone. No way. We need each other. And whatever way it goes down, the victory is ours. No way. There's no way. We need each other. And I'm very encouraged to see the leadership here mature, courageous, generous, truly for single payer. And that's what it's about. So if everyone's okay, and I don't see any hands up, because I like to feel closure. I think that concludes our meeting. Phil, if you'd like to drop in how people can get engaged with AB 1400, and HCN, I'm going to ask them to email people about staying on top of the governor's commission as well, and making sure single payer comes out on that side too. Like we need all hands on deck, firing at all, full power, all cylinders. Eddie, I'm going to mute you. So for our remaining panelists, if you'd like to take a minute for some closing remarks.
Look, I was thinking about this earlier. One of the reasons that this is always important to me on a very personal level is my older brother, sick with the flu, no health insurance, needed to go to work. So I can't remember what he bought. Either bought Dayquil or NyQuil, right? The doctors will probably know. He had high blood pressure, had a stroke because of his high blood pressure and the mixture of the over-the-counter medication. He is now on permanent disability. But had he had the ability to see a doctor, his life might be different. And if we just to talk about cost, this was about 12 years ago when this happened. So, would it have been cheaper for him just to be able to see a doctor, or now have Medicare and Social Security for the rest of his life? To me, this is always very personal, but I am encouraged, Jenny, and I want to thank you for inviting me to this. But I'm really, really encouraged to see so many great young activists here. Thomasina, Selena, sisters, keep up the fight. Let's keep pushing, and you know, this ultimately we keep fighting, and you know, it may not get done soon, but seeing all of you on here, all of you great young folks from labor, I am thoroughly encouraged that victory is one day in front of us.
And Jenny, I'll be brief because I've spoken a lot, but I'll just say, look, my mission in public service is to reduce suffering. To my core, I believe healthcare is a human right, and we're denying a human right to millions of people, and we're causing far too much suffering. And so I'm grateful to all of you for having those same values and principles. And I look forward to continuing in the fight with everyone.
Thank you so much for being here. Mark, Assembly Member.
I would just
Analisa,
add quickly,
Michael?
sorry, it's very personal to me as well, and I'm very sorry, Mark, for your brother. As a gay man, I survived the AIDS pandemic, and a lot of guys my age did not. And I'm determined as a diabetic to survive this pandemic as well. And we can never forget that, that we are trying to save lives, and to understand that this is ultimately the place where public policy most intimately affects our lives. And people bring so much to this, and it's so devastating to hear the stories like Wendy and Mark and others have mentioned. And so I always want us to remember that, that when we disagree with each other, or we get into these struggles over tactics and strategies, that ultimately, if we don't lift up the personal, then we're not actually honoring what this issue is ultimately about. So I really appreciate that.
I just wanted to say thank you for inviting me here tonight. As a practitioner in workers' compensation, I hear these stories and struggles every day. I mean, it just makes you realize how tenuous things are. Things we take for granted, such as employment or health insurance, can in an instant be removed with a catastrophic injury, or sometimes it's just even an overtime wear and tear kind of injury from doing the job day in, day out. And just the need for a comprehensive system. I mean, one of the things about workers' comp, yes, it is enshrined in our California Constitution. And I know Mark had mentioned, like, we need something like that on a universal health care basis. And then just also making sure that we can get the access to our dental, our hearing, vision, you know, all of those things are things we do have in workers' comp, although you have to fight to get them and jump through hoops of litigation. Shouldn't have to be like that. And I just feel very strongly that we need to implement a universal healthcare system. It's just and it's equitable, and I'm proud to continue fighting for that issue. Thank you.
Thank you all. Did we get everyone? Ara had to leave early, and Aki. Okay. Well, thank you all for joining today, and our guests for listening to our leaders and speakers, and our brave community leaders speaking out. It's really great to get together like this. I hope it's not rare. I hope we have more of this. Thank you all.
Thank you.
Have a great evening.
Thank you to the young workers. Thank you.
Thank you so much, Chang, for being such a wonderful moderator and for putting this together. You are truly a leader, and I am so honored to be able to work with you and call you a colleague and a friend. Thank you for this. And I think tonight, thank you all for joining us as well. The speakers, the attendees, everybody, this is so important. These conversations are what it's about. I mean, truly, I've learned so much just tonight. It's very moving, and I think these are the conversations that we need, and they need to continue. So thank you all for participating, and let's not be strangers. Let's do this again, and let's get Medicare for all. We're gonna do it. That's a promise. We're gonna do it.
Sí se puede.
All right, thank you all. Be safe.
Night.
All right, be
Thank
safe,
you.
everybody. Good night.
Good night.